Hey, there we go. Hello and welcome. I am so glad to have you with me today. We're going to have some fun learning some sclerology. If you're watching this on the replay, please take a moment to like the video, drop a comment, share it, subscribe to my channel. All of those things help this information to reach more people, and that's what this is all about. Those of you who are interested in furthering your education in iridology, I encourage you to copy down that link, which I will try to type into the chat box. And feel free, just let me, I can't talk and type at the same time. There we go. Okay, there we go. There it is, it's in the chat box. If you want to learn more about iridology and sclerology, grab that link. Now, I do have some standards involved in this, and we'll talk about those as we go through, but grab that link for now, and we'll talk about what it takes to get into my dynamic iridology course. Both iridology and sclerology are assessment tools. Neither of them is diagnostic. We cannot name a disease by looking at the eyes, unless you're an eye doctor and you're diagnosing an eye disease, of course. But as far as doing other whole body assessment, not able to do that using iridology, right? We can assess where strengths and weaknesses are. We can see where genetic potentials are. We can see where hot spots and nurture points are, but we cannot name disease. The iris, of course, shows us the genetic potentials. It shows us the epigenetics. I love to think of iridology as the epigenetics. It shows us where things want to be out of balance genetically, and it shows us when things are being triggered genetically, but it does not show us when things are reversing and straightening out, right? The irides accumulate, they do not disperse. And if you've been with me for any other courses, any of my other mini classes, you will know what that means. Otherwise, just keep hanging out with me and you'll catch on, I promise. Now, the difference here is that the sclera shows us where the issues are currently, and in some cases, it gives us clues as to what those imbalances are. Things show up in the sclera often years before they become clinical. So we want to balance off what we see in the sclera as far as what's going on right now with what we see in the irides, that genetic potential, with the client's symptoms and their diet and their lifestyle. This is a package deal. We want to have all of that information all together. But again, with the sclera, what happens with it is we don't see the order in which things should be addressed. The iris will help us to do that, but the sclera won't. The sclera shows what our end result is, what's going on right now, but we need the iris to help us understand how did we get to this problem and how do we get out of this problem. We always want to have 2 or more indicators teaching us about a potential problem, because each indicator adds a layer of depth to our understanding. Does that make sense? The more information we have, the better our assessment will be. If that makes sense, give me a makes sense in the comments box. Now, it's obvious that iridology and sclerology both take more than a mini class to learn, right? And Vanessa's saying it makes sense. Thank you so much, Vanessa. So today I'm going to give you a little bit of a background in sclerology. We'll look at a couple of different markings, and that'll help you to understand how sclerology works. Again, we need to dovetail iridology and sclerology and symptomatology and a conversation with our clients in order to really get that clear and concise picture of what's going on and what we should be working on and what order we should be doing things in. So here's the thing, iridology and sclerology are both learnable skills, and that's what's really important. So I'm curious, how many of you who are with me today have iridology training? If you've got training already, I want you to drop that in the chat box. Let me know that you have iridology training already. Okay, because when we're learning iridology, it takes, Carol says with me, and yes, she is one of my students, absolutely. So you want to be learning iridology. If you don't already have it under your belt, you want to learn it with a teacher who will mentor you, who will nurture you along. It's not something you learn in a weekend. The same is true of sclerology. And so we want to have the best training possible, right, to understand all of this. And Jada's brand new. Great, Jada, so glad. I'm glad you're with me tonight. Iridology meshes so well with nutrition and with herbology and with aromatherapy and with so many other modalities that are out there that it's a brilliant assessment tool. And so that's what I teach in the dynamic iridology course, is not just the nuts and bolts of iridology with some sclerology, but how to integrate it with the other modalities that you're currently using in your practice. So when we do an assessment, an iridology assessment, we look at the iris, we look at the pupil, we look at the pupil shape and its size and what its edge looks like, and we look at the sclera as well. Each of these give us a different layer of information, and they help us to build out the story. They help us to understand at a better level what we need to be doing, what's going on, and what we need to be doing with this. The iris is primarily inherent. Most of what you see in the iris is what has been passed down through the last 3 to 4 generations. What you see in the sclera is dynamic with a little bit of inherent or genetic stuff thrown in. Okay. The sclera is the white of the eye, Jada. The sclera is the white of the eye. And that's what we're talking about today, is sclerology. Okay. So when we are looking at the sclera, you already know this. You know that the sclera is really reactive. I want you to think if you've ever done this, or you know someone who does and you were with them, had a really good hard cry, like a sob hard cry, and then you went into the bathroom and you looked in the mirror and you splashed cold water on your face to kind of calm things down, and then you looked at your eyes and you were horrified at how bloodshot they were. Right? And so you just hung out in the bathroom for a few minutes, a little more cool water on your face, some deep breathing, some centering exercises, and it didn't take long for the whites of your eyes to calm down again. Right? The whites of our eyes, the sclera, very, very reactive. So that is what we're looking at, and we're looking at these blood vessels. Now, in the Dynamic Iridology Assessment System program, which is a course that is approved of by the International Iridology Practitioners Association, we will learn 12 of the most common iridology markers, or sclerology markers. So sclerology markers. We do a thorough job on the iris, and we learn 12 sclera markers as well. Today, we're going to take a quick overview look at 3 of those markers, 3 of the most common ones. So the first thing we're looking at in here is the overall color of the white of the eye. And you will see some people, like this gentleman, he's got some gray in here, but he's also got a lot of yellow. Now, I'm hoping your computer monitor is showing that well. Computer monitors are notorious for inaccurately. You don't see the pictures. Carol, thank you. I didn't share my screen, did I? I thought I did. Oh my goodness. Oh my heck. There we go. You got it now, Carol? Yes, great, fantastic. So those of you who were not seeing the images, that was not your fault. That was my fault. Now you've got them. Go you. Okay. Excellent. Thanks, Carol, for letting me know that I had forgotten to do that. Or actually, I had done it. It just wasn't showing up for some reason. Okay, so here we are. So when we look at these images, and again, your computer monitor may not show things the same as mine does. But on these photos, I can see there's a lot of yellow in here. Can you see the yellow tinge in there? It's not like a lemon yellow, but there's just that little tint of yellow in there. So when we see that bit of yellow, thank you. Yes, you can see the yellow tinge. Brilliant. This is what the medical world calls jaundice. There's a lot of reasons for jaundice to be there. And when we see jaundice, it suggests that the liver is not doing everything the way it should be doing. Very specifically, it tells us that the liver is not conjugating bilirubin properly. Now, you can get away with doing that for a little while, but it does suggest that there is something going on. Right now, we don't know what that something is, but we can see that it is there. And so when we see this, we need to do a bit more digging. Did the client bring in lab tests for us to look at? Is this something that the client knows they've got a problem with? There are some genetic conditions that affect the liver where the result is very innocuous, very harmless, as long as the liver is properly cared for. And people with those liver conditions will always be jaundiced. Now, people that have serious liver conditions will also be jaundiced. Okay, so we've got the full range from, so you've got that problem, not a big deal, to, oh my goodness, you've got that problem. I hope you are following sound advice as to how to work well with it. Now, one of the things we need to know with the liver is that it does over 500 different jobs. This is one of the reasons why it's so important that you understand anatomy and physiology when you start to learn iridology. And I don't mean that you know that the liver filters. I mean, here we're talking, can you list 5 separate things out of those 500 that the liver does? Right? You've got to know something about this, especially if you're going to work with people for their health. You've got to know how the body works. So again, when we see this, we want to know, does the client have a diagnosis from the doctor? And we always find out things like that right at the very beginning. Is there a personal or family history of anything? One of my favorite questions, right? And have you had any diagnoses from the doctor? That's another great question to ask, right? Because again, we need to know whether this is something that is being medically treated or if it's a benign situation. In the iris itself, we have a transversal, we've got a fiber skittering across right here. That's in the liver reaction field. So that would be an iris marker. And it says that this person does want to have some kind of a liver imbalance. We don't know what it is, but it's there. Now, that doesn't guarantee the person will have jaundice. The jaundice can be a standalone symptom. Now, here's the story behind this person's eye. This is a gentleman. He's in his 60s, his late 60s. He doesn't drink alcohol. He does take supplements. He is not on any medications. He's worked a lot in chemically toxic environments. And while that won't change his iris, it will change something or some things in his sclera, right? Because that toxicity, if the body has struggled to work with it, and he is still actively working in those environments, if his liver is struggling to work with all of that toxic load, we may see some jaundice for it. And so when we see this jaundice, we know his liver is not happy, and it has potentially been burdened with all of those heavy chemicals that he is exposed to. He's an oil patch worker, which means that he's often on the rigs, and there's a lot of solvents and things like that used on the rigs. And so he's been exposed to a lot of stuff. If his concern was that he'd noticed that his eyeballs had become yellow, and this was just a recent thing for him, then we can certainly give him some dietary advice. There are nutritional things that can help the liver function better. There are things to eat, things to avoid, right? We can also suggest that he get some sunshine. That would be helpful as well. We also want to make sure he goes back to his doctor. We need to see some lab tests. We need to know what's going on, and his doctor does too. We don't get to diagnose or prescribe even when we've got labs in front of us. But when I see that liver enzymes are out of balance and maybe there's some immune things out of balance, then I know we've got a bigger problem. And I'm going to encourage him to get as much information as he can from his doctor and to find out what would the doctor recommend here. And then I legally have to say that to him. I can give him other recommendations that are holistic and natural that he can work with as well. But until his medical tests come back, we need to encourage him to drink enough purified water every day, to get some sunshine, to get enough sleep, and to not skip any meals. Those are 4 of the absolute critical things to do when we see jaundice. When we see the gray clouding in his sclera as well, we want to chat with him about some other things, because this can be a serious situation. We're not going to dive into it now because we don't have time to cover everything I'd love to cover with you. But this can be a very serious situation, and it's something that we need to chat with him about, find out if he knows that he has a risk in this regard, and if he does, what is he doing about it? Right. Always with iridology and sclerology, we are looking at gathering information and empowering our client with information and education so they can take more control of their health. Right? We're not here to diagnose. We're not here to give them a doomsday prophecy. We're not here to tell them we can heal them. We're here to educate them. Does that make sense? As holistic practitioners, does that make sense? Yeah, Vanessa says yes. Excellent, excellent, excellent. So good. Yeah, excellent. Okay. Here's another gentleman. He is 70 years of age and beautiful, beautiful lymphatic blue eyes. His eyes are going to teach us about what a meander is. Now, you can probably look at his eye and go, oh, I can see a meander. I know what it means. I bet I know what it looks like. So this is a fellow, he's just over 70 years of age. He's lean and he's fit. He has a small hobby farm, and it is a small hobby farm. It's small enough that he doesn't see the need to buy big fancy equipment, right? I don't think he grows any grain or anything like that, but he's got some animals and they need to be fed, and he might have a tractor and, something to cut down the grass and the whatever's out there so that he can bale it up and feed it to his animals, kind of thing. But he throws the bales by hand. He mucks out the stalls by hand. He feeds his livestock by hand, and he does it by himself. He has no hired help at all. It's just him. So what would he like my help with? Well, he came in mostly because he's on my mailing list, and I got a new iridology camera. And I sent out to everyone on my mailing list and said, hey, you want to come in for 30 minutes, free session, in exchange for me getting your iPhotos to use in teaching. And he said, pick me, pick me. So there we go. He came in. He didn't have any known health issues, which is pretty amazing for a 70-year-old. He was on no medications. He gets regular physicals, and his last one, he had a clean bill of health. His labs came back great. So that is brilliant. When I looked at his irides, they tell me things like he tends to want to be too acidic. Well, his diet could use a little bit of improvement, but at the age of 70, he's probably not going to listen to me. But I did notice in his sclera some things that I went, oh, okay, we do have some things brewing here. We do have some things brewing. And so when we see this is specifically called a meander. Can you see why it's called a meander? This vessel just meanders around, kind of like a little river running through a farmer's field, right? He's got lots of meanders. Now, meanders are these vessels that are twisty and turny, and they suggest a predisposition towards congestion in his circulatory system. Depending on where it's placed in the iris, or in the sclera rather, will tell us which organs are at risk, which organs are having their circulatory systems congested. So, when we see this, we know there's that congestion happening, but we need context, we need background in order to really understand this. Without that context, without knowing who he is, how he eats, what he does, this doesn't mean nearly as much. We need to have that understanding. So his sclera, in spite of the fact that he seems to be in good health, he's got a lot of these meanders, right? So it suggests that he has some circulatory situations setting themselves up. Okay, now that's interesting because while he is very healthy, he also drinks a lot of alcohol. He is a member of the oldest Kiwanis service club here in Calgary. And he and his buddies are all oil patch friends. They all work somewhere in the oil patch. And every Kiwanis club meeting, which I think is like every 2 weeks throughout the whole year, the bar is open. And for one meeting in one evening, he can easily knock back 4 or 5 drinks. And he reports to doing the same thing when he's at home. Only drinking in the evening, 4 or 5 drinks in the evening to help him relax, kind of thing. Not the best thing to do, but we know that alcohol stresses the liver. The liver has an awful lot to do with everything, including how the circulation works, right? And so we've got this problem that he has the constrictions and the congestion in his blood vessels. Now, could that be because of plaque buildup? Yeah, it could be. It absolutely could be. But there could be other causes as well. Because of his alcohol consumption, I would want to see some labs. So he wasn't a genuine client of mine. I didn't, do the full intake. It was just a 30-minute curiosity session really for him. But if he was to become a regular client, I would want to see labs from his doctor, because I see here some inherent risks for his cardiovascular system. I see risks for him as well with his lipids and his triglycerides. So his cholesterols and his triglycerides and his blood sugars. And his sclera suggests that he is beginning to create those kinds of problems, but now they're really subclinical. So it's not showing up as a symptom just yet. I certainly gave him some ideas of things he could do, suggesting that he reduce his alcohol intake did not go over very well. He really enjoys his alcohol. And, men his age drink alcohol is kind of what he said. Okay. So we had to go other directions with, he's physically active. That's good. So could he eat more leafy greens? Were there other things that he could do? And that was where we went with him. With suggesting diet was really just increase his vegetable intake. But here's the problem. To look at this fellow being lean and quite fit, you might not think he could be at risk for cardio issues or blood sugar issues, but his eyes tell a very different story. When we look at his iris, we see risks that suggest a bit of a predisposition towards, again, the triglyceride cholesterol kinds of issues and liver imbalances. We look at the sclera, we see even more. And we need to remember that with all of this, it's not one marker means one thing. It's when we add the markers together, what is the story they give us? What is the full picture here? And with him, I see risks with the possibility of some cardiovascular problems. Now, he's in his 70s. He's still young enough to make changes. He is still young enough to reverse things like that could be going on. Will it take time? Absolutely. It's probably taken him 50 or 60 years to build this up. But with focus, we can at least begin to slow it down and reverse it. Now, I can't diagnose things like high cholesterol or triglycerides or any other things, high blood sugars. I can't diagnose that from the eyes, but his sclera certainly show me that something is brewing right now, that something is in the offing and should be addressed sooner rather than later. Here's some more good examples of meander. This is a woman. She was in her late 30s. She came in wanting help with allergies and depression. You probably already know that allergies and depression can have many physiological root causes. She has the lymphatic constitution. So we've got that base of blue in her eyes. And there's a lot of other colors on top of that base. There's some orange and lots of rusty looking freckles. There's some yellow in there. We've got this yellowish blob in her eye and both of her eyes that looks like chicken fat in each of the sclera. So those often happen laterally, sometimes medially on the sclera. It's called a pinguecula, and it suggests that she's had issues processing protein and fat and calcium for some time. The more yellow they are, the more problems it suggests she's had with her fats, especially. Now, pinguecula don't dissolve and they don't dissipate. They can be surgically removed, but they usually grow back, which says that the root cause of the problem wasn't fixed, right? If it grows back, it wasn't fixed. Interesting also that these irides show a strong liver predisposition in oh so many ways. And we've got the iris markers and sclera markers all pointing to the liver. So this is pointing to the liver. Even the way that this meander rather is sitting is pointing upwards towards the liver zone. So that gives us a clue that the circulation in the liver is part of what's getting congested. So I would recommend to her some liver work. We would do some dietary work. Now, she's a personal trainer, so she's very active. That doesn't mean she always knows what she's doing with her foods, right? Oftentimes, the people who appear to be very fit are not really on top of the game when it comes to nutrition. So we need to work with her with diet, herbs, lifestyle. She's very active. Actually, one of the things we needed to work with on her was to slow down because she's very competitive as a triathlete and a personal trainer. So we had to really encourage her to slow down. At the time that I worked with her, she had moved out of her own apartment, not as in moved all her stuff out, but she still had her own place, but she had to move in with her mom who was suffering dementia. And so she was trying to care for her mom while working full time, while training for races. And we had a little chat about when is enough enough? When do you say you need to do less of something and do a little more self-care, right? And so we also needed to look at the emotional challenges that she was having with balancing, 17 things all at the same time. So, some things that I recommended, we started her with one dietary change. She already had enough to think about. I wasn't going to do a clean sweep on her diet, right? So, and I bet I forgot to hit record, didn't I? I know I did. I hit record. Just forgot that I had. All right. I hate those little flashes that come. Did I remember to do that? Do you do that? Do you? It used to be when I was young. Did I remember to turn off the iron? We don't use irons anymore, I don't think. Okay, so suggested to her that she eat more leafy greens and just add one serving a day. Suggested that she start using a herbal liver support formula from my favorite herb company. That would be something she could do. Take 2 or 3 capsules of that in the day. Goes down quick and easy. I also really encouraged her to get some rest, right? Just to take even 30 to 45 minutes a day and stop. Or go to bed a little bit earlier, but just stop. Also suggested that for her emotional health, since she wasn't going to make time to work with a counselor, that we use a flower essence formula that I made for her. And I did suggest that she try to make time to get professional counseling as well, because she was carrying a huge load by herself. She does have siblings, but none of them live close enough to be supportive. So really challenging for her. The iris and the sclera work together and help us to understand the imbalances, what the imbalance is, and how to work with the imbalances. But it takes training and practice and feedback and mentoring to get you to where you can do this at a clinical level. That's exactly why I do teach dynamic iridology, is to help get practitioners up to speed. Get them the nuts and bolts and then teach them how to build the car, right? The encapsulation vessel. Right here, we've got that little vessel that looks like a candy cane or a shepherd's hook or the top of a walking cane. And we've got one here that has looped itself right around. These are both types of encapsulation vessels. When we see a blood vessel that's curling around like that fish hook, it suggests there may be an infection or a pocket of toxins that the body is trying to sequester until it can deal with it. Sometimes the fish hook closes off completely. Sometimes it doesn't. So here it's not closed off completely. Here it has closed off completely. Okay. And the more closed it is, the more that hook comes around to form that little loop, the more closed off it is. So this one, the body is still willing to try to take the garbage out and to deal with it. This one, the body's saying, yeah, I'm going to leave this. Going to take you a lot of effort to dig this out and get rid of it. We're just going to leave it here where it's kind of safe. Carol says, when you see it in both eyes, is it about the same source? You'd be looking for position to know if it was the same source. Because position in the sclera is everything, right? So these pockets can be so small that the client might not even be aware of them. And we're talking about what we see in the eye. They might be large. They might see a big shape in the eye. And so the client might go, what's that? Right? Physiologically, these can create things like cysts or swollen glands or abscesses. And this is on its way to creating that. So the client may be aware if they've got a cyst or an abscess. Probably if they've got an abscess, they do know it. When we see the fish hook in the image on the right here, when we say it's more than a fish hook, it's an actual loop, that suggests a risk that this person had a kidney infection that has maybe not been entirely resolved. So you'll want to ask your client questions to gain clarity here, and then make appropriate recommendations. And some of those recommendations might be going back to their doctor, going back to their doctor for lab tests, getting more information, finding out what's really going on here. When we see these, regardless of whether it is a complete encapsulation or a partial encapsulation, we need to ask questions about health history. We need to understand what's going on. Only then can we make appropriate recommendations, and we never diagnose. Depending on your training, you might be able to requisition labs. If you're a functional registered nurse, for example, or a nurse practitioner, you might have the licensure to requisition certain labs. And that would be great if you do. But otherwise, we are sending our clients back to their doctors to get appropriate labs. Now, having said that, depending on where you live, those of you who might be living in the States, you have access in many states to freestanding labs where you decide what tests you want and you pay the fee and they do the tests and give you the results. And that's lovely if you've got someone who can interpret them for you, right? If you don't have that, if you're like what we have here with our socialized medicine, we can go to the doctor and we can say we've got a problem, talk about a problem, and then it's up to the doctor to decide whether he's going to requisition the tests for you or not. This is what one of my graduates said. Angela is a dental hygienist. She says, what a fantastic course and with a fantastic teacher that actually cares about your success. I'm so happy that I found her. Yes, Angela graduated from my dynamic iridology program to become a certified iridologist through the International Iridology Practitioners Association. She goes on to say, I'm a registered dental hygienist, have been for 20 years, but have been studying naturopathic and homeopathic modalities on the side to help my own family. Now I want to open my own business using iridology to help others be healthier. I've already signed up with Judith for her next class so I can brush up on the body systems and learn herbology along with it. So cool, so cool. Now I've been giving you lots of information. There's more information to come, but I haven't introduced myself yet. So I am a certified level 3 iridology instructor with the International Iridology Practitioners Association. Level 3 is the highest level of instructor they have. And when I checked last week, there were still only 10 of us in the world. So I was one of the first 3 to gain the level 3 certification. IPA just started recently at issuing badges when we complete our upgrades every year. But I've been in the holistic health world since 1979. And I started working clinically in 1981. I've studied iridology under 8 different teachers, 3 different styles, and I have seen a lot of change in iridology over those years. Things that I learned 45 years ago, I know I don't look that old, 45 years ago, a lot of it we now know was incorrect. There's new information, new research out there. And so that's the beauty of being current and up to date, is knowing what the new stuff is, right? I've designed and taught many different holistic health courses. For a while, I was even a certified prenatal educator and designed and taught courses for that. But my focus, I love working in the clinic with pregnancy and infertility and childbirth, but I also love teaching practitioners a whole lot. I've taught herbology courses and biokinesiology and color therapy courses, of course, Iridology, the prenatal classes, all kinds of classes. In 2022, IPA awarded me the Instructor of the Year, which was pretty much a shock. And I truly loved it, appreciated that. And in 2024, I was honored to be named as the Iridologist of the Year through the IPA. So that's very, very cool. Very cool. I am also a holistic nutrition professional associated with 2 different organizations here in Canada, and a master herbalist associated with the Alberta Herbalist Association. All right, let's look at some more eyes. These are the eyes of a 79-year-old man. A lot of these eye photos are old guys. He came to me. I got to tell you, we had so much fun. He was the most fun fellow to work with. We did, we laughed. We poked fun at each other all the time, and we just laughed and had a great time. But he came in because he had excess abdominal weight, and he didn't really care so much about the weight, but what he cared about was the weight was affecting his knees and his ability to walk, and he was in constant pain. It was affecting his mobility. He had had prostate cancer that had been treated with radiation and hormones, and of course, they give the man estrogen when they've had prostate cancer. And estrogen, as most women know, makes you gain weight, right? And that's exactly what it did to him. His doctor also diagnosed him with congestive heart failure, and his symptoms were an irregular heartbeat, shortness of breath, and he had reflux and heartburn as well. When we met, he was on 8 different medications, including an anti-anxiety medication to help him stay relaxed, because he would sometimes get into problems breathing, that shortness of breath, and he'd start to panic. So then they gave him something to calm his nerves down. He also had a hiatal hernia, which had not been diagnosed by his doctor, but there's a quick little assessment that I was taught many years ago, and I did the assessment, and I couldn't say you have a hiatal hernia, but I could say, you know, when people breathe like that, it usually means the diaphragm can't move because the stomach is sitting in the wrong place. Now, I'm going to suggest that you go see this osteopath and have the osteopath do some visceral manipulations to get that stomach, to see if the stomach is out of place, and if it is, get it put back into place. And so he went and did that and could suddenly breathe again. He had spent many years struggling to breathe laying down. I got him to go onto a wedge pillow at night. Now he could sleep through the night because he could breathe. And then when he did the osteopathic work and got all of his internal organs put back where they belong, he was able to breathe much better. I had to wonder if he was insulin resistant. He certainly appears to be very genetically prone to having excess uric acid and excess acid in general. He's got these gray patches in his eyes again. We've seen those before. Notice he's got the pinguecula. And down here at the ends of these blood vessels, he's got little clouds, just little dirty clouds. That's what we call a fermentation sign. And it suggests that he's not digesting his carbs well, and that is likely messing with his cholesterol and his blood sugar balance, and might be creating a bit of a yeast infection for him as well. So when we look at his eye and we see that we've got this pigment sitting right here, that's a liver pigment sitting in a liver zone. It could also be a pancreas. Liver, pancreas are both orange-brown and sitting in a liver zone. Dirty yellow colors, just dull, dirty yellow colors throughout his eyes suggest the uric acid. And we know that elevated uric acid also contributes to insulin resistance and cardiovascular issues. Right? This is a left eye. Yes, it is, Carol. Good job, Carol. I taught you well. When he brought his labs in, his hemoglobin A1C was 7.7. Anyone know what your hemoglobin A1C should be? I'll tell you, 7.7 is elevated. Hemoglobin A1C. What do you think would be a healthier number for that? Under 6. Yeah, under 6. Yeah, between 5 and 6 is ideal, right? Carol, you caught me. You are absolutely right. See, I teach my students well, and I teach them to correct me if I misspeak, right? Carol knows that. This is good. Left eye means this is actually the spleen area. So this is saying pancreas and liver want to affect the spleen. Okay, so good catch, Carol. Nicely done. Nicely done. Ideally, you want the hemoglobin A1C to be 5.7 or lower. Anything over that suggests insulin resistance. When you get up to 7.7, you are definitely insulin resistant, according to what the medical world says. And I would agree with that. His labs came back with low leukocytes, low lymphocytes, very low normal hematocrit, low erythrocytes, very low testosterone, which of course with the prostate cancer, they wanted to keep that low, and elevated triglycerides. So his initial program, again, I gave him some hiatal hernia exercises to do while he was waiting to see the naturopath or the osteopath. I recommended berberine IR because that can be helpful in bringing down the blood sugars, making the body less insulin resistant. I recommended glucosamine, a glucosamine blend for his joints and for his gut health. Did you know that glucosamine helps to heal the gut lining? And we recommended omega-3, which is anti-inflammatory, good for elevated cholesterol, for helping to break that down and bring it down, good for so many things. Now, his diet, he was working off a diet recommendations from maybe the 1980s. It was really not good. His breakfast was rice cakes with marmalade. And it was because that had no fat, and therefore that would not hurt his cholesterol, right? And so the very first thing we did was suggested that he have vegetables, a stir fry of vegetables with a couple of eggs for breakfast. And the look on his face, he's an English fellow, and the look on his face, vegetables for breakfast? I don't think so. That's not a proper breakfast. I said, well, just, what do you think? Give it a try for a week. Let me know what you think. He said, well, I'll try anything for a week. He sent me an email after about a week, and he said, wow, if anyone had told me I would actually enjoy protein and vegetables for breakfast, I would have told them they were crazy. Oh, I think I did tell you you were crazy, but I really do enjoy this. All right. So like I said, we poked fun at each other. He did so well with that, so well. And I suggested that he should walk 30 minutes a day. Oh, wait a minute. Walking hurts, right? So I said, start with 5 minutes. And if you can do 5 minutes 3 times a day and gradually build that up to 10 minutes 3 times a day, you'll have your 30 minutes. When he came in for his first follow-up, he said, I'm actually walking 45 minutes straight through, and it feels good. I was like, yes. He also said that he was wearing pants he hadn't worn in several years because the ones he used to wear like 4 weeks ago were too big. They were having to punch holes in his belt. He said, but the bathroom scale doesn't say I've lost any weight. And I said, yeah, but you're losing water. You're converting fat into muscle. Well, you don't actually convert fat to muscle. It's not an alchemy thing, but you're burning fat and building muscle because you're being physically active. That's all going to have a positive effect on the cholesterol, right? On the inflammation, on the circulation. It's going to be positive all the way around. He was so excited. He had never lost weight before. And to do it so simply, we just gradually added in more of what he should be eating and eased out things that were bad information kinds of foods, right? Kept him walking, and gave him ways that he could cheat once in a while if he really had to, but don't do that very often. Don't cheat every day, right? It was so good to see how much he improved. And when we look at it here, it was really these fermentation signs that caught my attention that said, we're probably looking at insulin resistance, not handling your carbs properly, all the things that go along with that to create this perfect storm. Pretty simple stuff. And then his labs bore it out, and there was iris markings that bore it out as well. And we were able to get him some results. So when you learn iridology and sclerology, now I just want to ask you, how many of you are working with clients or are in school studying something that you will be working with clients? If you're working with clients or you will be working with clients, just put me in the comments box. In school, planning to work with clients. Good job, Vanessa. Carol, yeah, excellent. Brilliant. Anybody else? Jade is a reflexologist. Lovely. Nice. Very nice. This really correlates well with reflexology. Just saying. Then you might just want to add some herbology or some nutrition under your belt to really get your bang for your buck with all of this together. Yeah. Okay, so with iridology and sclerology, you'll be able to assess your clients much more quickly. If you currently use an intake questionnaire that is more than like 3 questions long, you're wasting time. You need to have a signed release form. That just is a given in this industry. You need to have that. But questionnaires waste time. They waste your client's time. They waste your time. If you want to assess your clients quickly and accurately, iridology and sclerology combined with their symptoms are the way to go. If you want to develop better and faster rapport with your clients, iridology and sclerology are the way to go. And again, this eliminates the need for an intake form. I have an intake form. My clients never see it. They fill out the release form, and then there's 3 pages of intake. And as I am speaking with my client, I fill in the bits and pieces on that intake form that I need to fill in. Oftentimes the intake form is half empty because the questions are irrelevant to where my client is at right now, right? And that's the problem with an intake form. It's a shotgun pattern when what you're really looking for is a laser pattern. You want to be ultra focused to get to the root of the problem, not kind of meandering all over the place, getting general information. Now, the challenge is that most, let me just catch my notes here. Iridology helps you to understand your client on a very deep level. So you can create a program on the spot that will start getting results really quickly. And that's why I love dynamic iridology. Being able to see the genetic predispositions in the irides and triangulate that with what you see in the sclera and with their symptoms gives you your blueprint for what you need to be asking. And that gives you your outline for what you need to be recommending. And it helps you to limit your recommendations to things that will be effective and manageable by your client. It is true that most of our clients need a complete dietary overhaul, but you cannot do that in one appointment. Not and think they're going to last for very long. Some people might last for a day and a half or 2, and then it just gets to be too hard. So with iridology, you can be much more, you can rein that in and give recommendations that will be effective very quickly now, right? Most iridology courses teach only markings. They don't teach the correlations of sclerology to iridology or sclerology to health risks or the integration of all the different iridology points and how they work together. They don't teach you how to actually think through an iris assessment. What most iridology courses teach you is how to do case studies. That is a part of the educational process, but most courses end there. case studies, and they assume if you can do a case study, you can do a client session. I guarantee you that a case study is entirely different from a client session. They are very dissimilar. How many of you have had to do case study work for some other credentials you've worked with? Any of you? Yeah. And do you find, and Carol, yeah, well, Carol's doing her cases for iridology, which is, yeah, so you really get this, Carol. Yeah, many of you, right? And so did you see in doing that, that in doing a case study, you gathered too much information that took you in too many directions, and it made it difficult to focus in on what needed to happen? Or you made all of those recommendations and it took your client into true overwhelm? Did you notice that? So important that we not do that to our clients. If we want them to be successful, we need to have the training that helps us laser in, choose the markings that are appropriate, give the client just enough information to get the results they want to get over the next 2 or 3 or 4 weeks, and then meet them again, rinse and repeat, give them another step, and do this step by step so that they're learning new habits instead of getting overwhelmed and frustrated and quitting. One of my favorite sayings with my clients is, I want you to be a massive success in baby steps rather than a huge failure in one step. Yeah, Jada, overwhelmed, too much info? Absolutely, absolutely. So if you want to get good at assessing your clients through iridology and doing it accurately and quickly, creating that rapport, getting rid of these long intake forms, but being able to create succinct, specific programs for your individual clients in your sessions, not outside your sessions, you doing extra homework, but in your sessions, then we should chat. This is what one of my grads said. This is Karen Choate. She is a CNHP. I think she's actually got an ND now as well. This is a few years ago. She sent this to me. I just returned from a regenerative detox course where iridology is implemented. Most people I talked with did not have anywhere near the same experience with their iridology education. They had no support, unanswered questions, and a lot of confusion. Mostly they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed to have been taught by you. I feel totally supported, even still, as I have graduated. I think it's about 6 years ago now. Oh my goodness. And so, and we're still in touch. I don't kick my students out of my world when they graduate or when they get certified. They're still in my world. So we are still in touch, which is very cool. And she has learned, she's got a lot of extensive training in gut health and in testing for gut health. And she uses the iridology to help narrow down what she needs to know and what she needs to do with that client, which is very exciting. Kimberly Zadalis. Oh my goodness, I adore Kimberly. I got to tell you, I adore all of my students. My students are simply the best. She came to me so well trained, I was almost intimidated. She's has a master's degree as a radiology assistant, and she has just all kinds of other holistic training under her belt. She didn't have iridology yet. She said this: if you are wondering which iridology course to take, you can stop looking. You found it. Judith Cobb is an excellent instructor with many years of experience. She is a caring and compassionate person who is dedicated to the field of iridology and her students. I personally practice both Eastern and Western physiology medicine and was very impressed with the layout of her program. She makes it easy for her students to balance work, life, and study. Really appreciated that. So the Dynamic Iridology Assessment System is the only live, online, fully mentored course for nutritionists, herbalists, and naturopaths. And think of that as anybody who has a college-level anatomy and physiology course under their belt. Maybe you had to do a separate A&P course as a part of your herbal studies, or as a part of your reflexology work, or as a part of your nursing degree. Of course, if you're a nurse, you've got that, right? If you've got A&P, then we can talk. And the purpose of teaching you is to teach you iridology so that you don't have to work unpaid overtime developing client protocols. You can do it right in your paid sessions. so that you can create programs that your clients can actually do and not overwhelm them. Because when you give them the right amount of homework, they can be successful, they can find results. That increases their compliance. That increases the long-term retention. They want to keep coming back to you. Maybe they're in for 4 or 5 appointments over the next 5 or 6 months. They're feeling great. They disappear for a few years. But when something starts to slip or when there's a crisis, they will call you. I've got clients that have been with me for 4.5 decades now. I've had many clients for 20 to 30 years, and they disappear for a few years, but they all come back. They all come back. And the goal here is to streamline your work, help you get more work done with less effort without sacrificing your client care, because you've built a reputation and you want to make sure that you don't sacrifice that, right? So important, so important. So, okay, where's my slide? There we go. So if you already have that college level anatomy and physiology, and you want to learn iridology and sclerology at a professional level, you want to learn how the markers play off each other, you want to learn what questions the eyes want you to ask, maybe you want to learn as well how to create programs your clients can be more successful in implementing, and you want to be mentored for the long term. And I am talking years here, not just when you're enrolled in the program. We've all done programs, haven't we, where you do the course, and as soon as the course is done, the door slams shut and there's no more support. I've had students that have been certified as iridologists by other iridology teachers, and at the end of their course, when they went to their teacher and said, how do I work with this? The teacher said, oh, you'll figure that out. I don't do that. I don't throw my students under the bus. We have long-term mentoring as my gift to my students. If you were my student, you get mentored. For as long as I'm teaching, you get mentored. You have a place to ask business questions, to bring difficult cases to, somewhere to come and get some encouragement if you're having a down week, right? You get mentored. Maybe you want to know what's included in the course so you can make an informed decision. So again, if you have that college level anatomy and physiology under your belt and you're looking for an iridology course, I'm going to put this in the chat box again. Oh darn, I just closed the chat box. I'm having a technical day. You know, do you ever have those where you just keep hitting wrong buttons? There we go. There's the link in the chat box. So if you've got a college level anatomy and physiology course that was at least 60 instructional hours, and you got a grade of 80% or higher, that would be a B or higher, then grab that link that I just put in the chat box and let's talk. The next the next iridology course, Dynamic Iridology Assessment System course, is starting on May 15th, right? And registration is open. That's just a month away. So if you are thinking, yeah, I want more information, use that link and let's talk. If you don't have anatomy and physiology, please do not book an appointment. Instead, shoot me a message somehow, even right here, right now, and I will send you a link to an anatomy and physiology course that meets the requirements. These requirements have been laid out by IPA, by the International Iridology Practitioners Association. And I have to admit, it's so much easier to learn iridology well if you've got your anatomy before you come into the iridology program. So if you need an iridology program, let me know. Here we have one more set of eyes. We're going to go a little bit over the hour, so I hope you're okay staying with me. This is one of the clients who's been with me for about 25 years. I started working with her before she and her husband had their first baby. They wanted help getting ready to get pregnant, and I'm always excited to work with clients who are in that situation. And so we see her iris here, but let's look at the sclera. This is her left sclera, right? We've got meanders in here. So these were taken, like I said, these were taken recently. She's in her mid to late 50s now, but we've got all kinds of things going on in here. But I want you to watch the clouding, those little dirty clouds that we see in there and here. Okay. going to pop back a few again. So those bits of dirty clouding were up in the sclera here. Again, remember, they tell us that she ferments things. She's fermenting her carbs. She is likely fermenting her carbs. Her liver's not handling her carbs very well. And, when we see this says her liver hasn't handled carbs really well for quite a while, right? So when I saw those little, and her eye structure, the fibers in here also suggest that she's at risk for hormone imbalances. She needs to be careful with her food intake, with what she's eating. So she was sitting in my office and I looked at this. I said, her name's Michelle. You'll never know who she is, so I can use her first name here. I said, Michelle, I'm really concerned. And she said, why? And I said, because this looks like you're walking straight towards type 2 diabetes. So I didn't say she had it, but I said, I see some risk here. And she started to cry. And I asked her, I said, Michelle, what's going on for you? Help me understand where you're at right now. And she said, my dad has type 2 diabetes and it's awful. She said, I promised my 2 sons I would never do that to them. I said, well, Michelle, you're young enough. You can get a grip on this. You don't have to have type 2 diabetes. But everything I taught you 25 years ago about nutrition, you have forgotten. You're not doing any of it. And so we need to start with your self-love, that you are worth it. And then we need to start making some dietary changes and some lifestyle changes, just one at a time, to get you moving in the right direction. She came to me because she'd gained 30 pounds over the last 5 years, and she didn't like that. Most of us don't, right? But I could see why. The insulin resistance undercurrent is there, and she is at risk, at significant risk. In fact, I suggested she go to her doctor and get some labs done, which she refused to do because she didn't want to hear it, right? So we're working with her on changing her core beliefs about who she is and working on changing her diet at the same time. And it's a slow process because we are working with some really harsh core beliefs. So with that, my friends, here's that again. The Dynamic Iridology Assessment System course is coming up starting May 15th. And I would love to have you in on it. Oh, we've got a couple of different URLs here. I think they'll all work. I usually proofread things better than this, but today it slipped by me. Just let me double check this for you. Yeah, we're good. They'll all work. They'll all end up in the same place. So grab one of those links and let's talk. If you are ready to start learning iridology and you've got that A and P under your belt, let's talk. The Dynamic Iridology System course is 20 weeks long, and we do spend 2 full weeks on sclerology as well. Okay, so you get iridology and sclerology in the Dynamic Iridology Assessment System course. So with that, any other questions before we wrap up? We've gone a little bit over. Are you good? Is there anything else you need tonight? If you are typing a comment, just use the raise hand icon so I know to wait for you. Otherwise, we're probably done. Carol says, thank you. Always learn something so good. Vanessa, you are welcome. Brown says, great introduction. Thank you. Excellent. Good to have you with us. All right. Well, with that, I think we're done for tonight. Have a brilliant evening, and we will talk to you soon. Bye for now.